Hey guys, welcome to Mr. Diagnosis.
In fact, everything, the colds, the fatigue, the cramping, is all getting worse. Then Josh notices a new bizarre development.
She seemed to be putting on weight. Her stomach around her midsection got large. And
she looked like she was 4 months pregnant or 6 months pregnant. She was just huge.
But Stephanie doesn't see it.
When you see yourself in the mirror every day and you're gaining some weight, it really, believe it or not, didn't set any alarms off in my head that something was wrong. I started to have yellow skin.
Well, it was just
The yellow skin is called jaundice.
tint to her.
My eyes were yellow.
not really dark, but just that they weren't her normal color.
What causes jaundice is the liver. I know that because the psoriatic arthritis affects the liver.
The blood tests show Stephanie has elevated liver enzymes, an indication that her liver has deteriorated.
Stephanie's level of liver dysfunction was so severe that if we were not able to establish a diagnosis, immediately her only option was going to be liver transplantation.
She was gray. She was weak, extremely weak.
But first, he needs to get a closer look at the liver tissue, so he orders an immediate liver biopsy.
I was a little bit nervous going in for the biopsy.
A liver biopsy is normally a routine procedure done directly through the skin into the liver. But the liver dysfunction has caused Stephanie's blood to stop clotting. Doctors know the standard method could lead to massive internal bleeding, and they can't risk it.
Our only alternative was to puncture the jugular vein in the neck and to thread a catheter down past the heart to the interior of the liver to obtain a biopsy.
I just remember holding Josh's hand as I was being rolled down to the operating room.
As the biopsy equipment was being threaded toward its target, it actually collapsed the right lung.
Doctors work quickly to stabilize Stephanie, but the biopsy is aborted before they can get a specimen.
This was a very significant setback.
I'm glad they
in what
aborted
was
it,
already
but she needed it.
a very sick young woman.
But with a biopsy now out of the question, Vierling and Feldman head back to the drawing board to find a way to diagnose Stephanie's problem before it's too late.
Asked an ophthalmologist to look at the clear portion of the eye called the cornea.
With liver disease, symptoms will sometimes manifest in the eyes. Dr. Vierling hopes Stephanie's eyes may offer some clue.
Found that I had copper rings in my eyes.
When the results from the other two tests come back, they tell the same story.
The blood work showed that I had excess copper in my system.
All the pieces of this puzzle together, it added up that she had excessive amounts of copper, and it was accumulating in her liver and causing her to be very ill.
It's Wilson's disease.
Wilson's disease is a rare genetic disorder where the liver can't rid itself of copper, a mineral found in many foods we eat. Eventually, the copper gets into the bloodstream, accumulates in various organs, including the brain, corneas, and kidneys, and interferes with organ function. If it's not diagnosed and treated, Wilson's disease is fatal.
So this copper accumulates and causes damage by replacing normal tissue.
Copper accumulation can also cause damage to the nervous system, leading to muscle cramping. Can alter hormone levels. There is no cure for Wilson's disease, but it can be managed
I
with
find it
medications.
interesting how they
Doctors
treat it.
immediately begin Stephanie on treatment.
We used a drug that binds with copper and takes it out of the body.
Copper basically started pouring out of my body.
After Stephanie started taking the medicine that they had prescribed, things started getting better pretty quickly. Within several months, her life started returning to normal. Stephanie's doing great today. As long as Stephanie stays on her medication, she's going to be wonderful.
After this diagnosis, we were able to really put our marriage and everything else on a track of where we wanted to go.
Our life together now is absolutely 100% normal.
I think that I will have a bond with these doctors for the rest of my life because I credit them with saving my life.
For people new to my channel, that black cat near me was Midnight. By the way, having 3 cats was an accident. Midnight came up one day and I just decided to adopt him. I mean, once you have 4 cats, I feel like that's too many once you get the 4th. But I decided to keep Midnight, despite already having 2. Midnight came up a few weeks to a month after I saved my boyfriend, Coleman Kevin's life, so I took it as a sign that I was rewarded for saving him. Thank you very much for watching. Make sure to like, comment, and subscribe. Hit the notification bell to know when I post a video. And I will see you next time.